Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic Introduction to Disaster and to Disaster Management Cycle under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: It's your reaction to adversity, not adversity itself, that determines how your life story will develop. Content outline: Introduction to disaster, types of disaster, levels of disaster, phases of disaster, disaster management cycle, recent updates, and multiple choice questions. By the end of this presentation, the participants would be able to define the term disaster and its various types, explain the different levels of disaster, describe the phases of a disaster, understand the concept of disaster management and its importance, discuss the disaster management cycle and its key components, analyze the recent updates or developments in the field of disaster management, and demonstrate understanding of the content through multiple choice questions. Introduction. Disaster is a sudden calamitous event bringing great damage, loss, and destruction and devastation to life and property. The damage caused by disaster is immeasurable and varies with the geographical location, climate, and the type of earth surface or degree of vulnerability. This influences the mental, social, economic, political, and cultural state of the affected area. Disaster is an acronym, can be regarded as an acronym for destruction, incidents, suffering, administrative and financial failure, sentiment, strategies, eruption of communicable diseases, and research program and its implementation. WHO defines disaster as any occurrence that causes damage, ecological disruption, loss of human life, deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. And Red Cross defines disaster as an occurrence such as hurricane, tornado, storm, flood, high water, wind-driven water, tidal wave, earthquake, drought, blizzard, pestilence, famine, fire, explosion, building collapse, transportation wreck, and other situations that cause human suffering or creates human that the victims cannot alleviate without assistance. Types of disaster on the basis of origin and causes. Disaster can be classified into natural disasters and man-made disasters. Natural disasters include hydrometeorological disaster, geographical disaster, and biological disasters. And man-made disasters include technological disaster and environmental degradation. On the basis of speed of onset, there are sudden onset disasters and slow onset disasters. The levels of disaster, there are three levels of disaster. Number one, if the organization or agency or a community is able to contain the event and respond effectively utilizing its own resources, it is known as the level one disaster. If the disaster requires assistance from external sources, but these can be obtained from nearby agencies, this is referred to as level two. And if the disaster is of a magnitude that exceeds the capacity of the local community or a region and requires assistance from state level or even federal assets, it is known as the level 3 disaster. Phases of disaster: there is a pre impact phase, an impact phase, and a post impact phase. In the pre impact phase, it is the initial phase of disaster prior to the actual occurrence. A warning is given at the sign of the first possible danger to a community. With the aid of weather networks and satellite, many meteorological disasters can be predicted. This is the period when the emergency preparedness plan is put into effective. Emergency centers are opened by the local civil detention authority. Communication is a very important factor during this phase. Disaster personnel will call on amateur radio operators, radio and television stations. The roles of nurses in this morning phase is to assist in preparing shelters and emergency aid stations and establishing contact with other emergency service groups. In the impact phase, this phase occurs when the disaster actually happens. It is a time of enduring hardship or injury and of trying to survive. This phase may last for several minutes, for example, after an earthquake, plane crash, or explosion, or for days or weeks, for example, in a flood, famine, or epidemic. This phase continues until the threat of further destruction is past and emergency plan is in effect. This is the time when the Emergency Operations Center is established and put into operation. It serves as the center for communication and other government agencies of healthcare centers, healthcare providers to staff shelters. Every shelter has a nurse as a member of disaster action team. This nurse is responsible for psychological support to victims in the shelter. In the post-impact phase, recovery begins during the emergency phase and ends with the return of normal community order and functioning. For persons in the impact area, this phase may last a lifetime. For example, victims of the atomic bomb of Hiroshima. Disaster management, it can be defined as the organization and management of resources and responsibilities for dealing with all humanitarian aspects of emergencies, particularly preparedness, response, and recovery in order to lessen the impact of disasters. The disaster management cycle includes the following phases. Number one is mitigation, number two is preparedness, number three is response, and number four is recovery. Mitigation minimizes the effects of disaster. Preparedness plans on how to respond. A response include the efforts to minimize the hazards created by a disaster, and recovery is returning of the community to normal. In the mitigation phase, there is risk analysis, risk appraisal, and land use planning. In the preparedness phase, there is technical prevention, capacity building, emergency planning, monitoring, and early warning. During the response phase, there is research and rescue, humanitarian aid. And in the recovery phase, there is damage assessment, rehabilitation, reconstruction. So in the mitigation phase, it reduces the impact of disasters by supporting protection and prevention activities, easing response and speeding recovery to create better prepared and more resilient communities. There are two types of mitigation. Number one is structural mitigation and number two is non-structural mitigation. In structural mitigation, it includes the construction projects which reduce economic and social impacts, for example, dams, windbreaks, terracing, and hazard-resistant buildings. In the given figure, we can see the earthquake-resistant buildings, with shear walls, cross bracing, and shock absorbers. In the non-structural mitigation activities are the policies and practice which raise awareness of hazards or encourage developments to reduce the impact of disasters. For example, public awareness for different types of insurance and family plans for some emergency situation. Mitigation includes reviewing building codes, vulnerability analysis updates, zoning and land use management and planning, reviewing of building use regulations and safety codes, implementation preventative health measures, political intervention and commitment, and public awareness. And the strategies include hazard identification and vulnerability analysis. Various mitigation strategies or measures, for instance, variety of crops that are more wind, flood, or drought resistance can often be introduced in areas prone to floods, drought, or cyclones, and economic diversification. Development initiatives for countries faced with disasters, partnership, close collaboration among donors, governments, communities, non-governmental organizations, the private sector, and universities. Flexibility. Development agencies must be efficient and flexible, adaptable to local environments, and capable of adjusting to changing conditions and seizing opportunities when they arise. Selectivity. Resources are the public asset that must be invested prudently to achieve maximum impact. Preparedness includes planning, training, and educational activities for things that cannot be mitigated. During the preparedness phase of the disaster management cycle, measures are taken to reduce the minimal level of possible of loss in human life and other damage through the organization of prompt and efficient actions of response and rehabilitation, such as practicing earthquake and fire drills. They also involve planning, organizing, training, interacting with other organizations and related agencies, resource inventory allocation and placement, and plan testing. Important areas: develop and test warning systems regularly and plan measures to be taken during a disaster alert period to minimize potential loss of life and physical damage. It includes educate and train officials and the population at risk to respond to the disaster, train first aid and emergency response teams, establish emergency response policies, standards, organizational arrangements, and operational plans to be followed by emergency workers and the other response entities after a disaster. Preparedness measures include preparedness plans, emergency training, warning systems, emergency communication system, and public information and education. Disaster risk reduction. It forms the action plans to be implemented before, during, and after disasters. The International Federation of Red Cross and Red Crescent Societies defines risk reduction as physical measures to reduce the vulnerability and exposure of infrastructure to natural hazards, as well and to provide coping and adaptive infrastructure in case of a disaster event. The figure shows the disaster risk reduction and climate change adaptation in Vietnam. The disaster risk reduction recommendations for countries which do not have a robust disaster preparedness plan is to have policy, planning, and capacity building in disaster management. Physical prevention, for example, building sea walls against storm surge or flood shelters during flood events. Capacity building at institutional and systematic level in disaster preparedness, and continued provision of food, potable water, and healthcare. Response includes the immediate aftermath of a disaster when business is not as usual. The response phase includes the mobilization of the necessary emergency services and first responders in the disaster area. This is likely to include a first wave of core emergency services such as firefighters, police, and ambulance crews. Healthcare intervention response starts here. The focus in the response phase is on meeting the basic needs of the victims until sustainable community has been achieved. It may also involve initial repairs to damaged infrastructure. Response activities are post activities geared towards providing emergency assistance, speeding recovery operations, returning systems to normal level, and reducing probability of additional injuries or damage. Recovery is the long term aftermath of a disaster when restoration efforts are in addition to regular services. The aim of the recovery phase is to restore the affected area and to its previous state. For example, lifelines, health and communication facilities, as well as utility systems. The beginning of the repair of physical, social, and economic damage starts here. Continued health monitor and care, reconstruction of vital facilities, counseling programs, grants, and it may include economic impact studies. Disaster triage. Disaster triage, the word triage is derived from the French word trier, which means to sort out or choose. Triage is the process of determining the priority of a patient's treatment based on the severity of their condition. Triage is the process of sorting people based on their need for immediate medical treatment as compared to their chance of benefiting from such care. The definition of the triage system, it is a process which places the right patient in the right place at the right time to receive the right level of care. And also triage is the process of prioritizing which patients are to be treated first, and it is the cornerstone of good disaster management in terms of judicious use of resources. The aims of triage includes to sort patients based on needs for immediate care, to recognize futility. Medical needs will outstrip the immediately available resources. Additional resources will become available given enough time. Purpose of triage is inadequate resources to meet immediate needs, infrastructure limitations, inadequate hazard preparation, limited transportation capabilities, multiple agencies responding, and hospital resources overwhelmed. There are two types of triage. Number one is simple triage, and number two is the advanced triage. The simple triage is used in a scene of mass casualty in order to sort patients into those who need critical attention and immediate transport to the hospital and those with less serious injuries. This step can be started before transportation becomes available. The categorization of patients based on the severity of their injuries can be aided with the use of printed triage tags or colored flagging. There is an acronym known as START, which is a simple triage system that can be performed by lightly trained lay and emergency personnel in emergencies. It is basically simple triage and rapid treatment. Triage separates the injured into four groups. Zero is the decreased who are beyond help. Number one is the injured who can be helped by immediate transportation, and two is the injured whose transport can be delayed, and three are those with minor injuries who need less help. In advanced triage, doctors and specially trained nurses may decide that some seriously injured people should not receive advanced care because they are unlikely to survive. in order to increase the chances for others with higher likelihood. So with the color coding, the priority 1 is color coded red, who may survive if given immediate simple life-saving measures. The priority order 2 is for yellow, who should survive if given care within a few hours. The priority order of 3 is color coded green, who are the walking wounded, minor injuries that do not require rapid care. And priority order 4 is coded as black, which are the deceased or severely injured patients unlikely to survive. Now it's time for the recent updates. The current capacities, preparedness, and needs of local institutions in dealing with disaster risk reduction in Khyber Pakhtunkhwa, Pakistan. Local institutions could play an essential role in providing first aid, rescue, and support to communities in reducing the impacts and vulnerability to natural disasters such as floods. Keeping in view the importance of local institutions, Pakistan has established disaster management authorities at a national and provincial level to collaborate with local institutions in dealing with natural disasters. However, little is known about the current level of preparedness and capacity of local institutions and capacity building gaps in managing disasters at the local scale. In order to fill this gap, this study conducted 40 key informants from 19 institutions working at local level to identify the current capacities, preparedness, and gaps in disaster management cycle of local institutions in Khyber Pakhtunkhwa province, Pakistan, using 5 indicators of disaster preparedness pillar. Disaster Preparedness and Management in Pakistan, a systematic review which was published online by the Cambridge University Press. The study findings revealed that the majority of the local institutions were underprepared in terms of awareness and training, human resources, financial resources, infrastructure and equipment, and coordination. The results further indicated that the existing preparedness capacity gaps should be bridged through capacity building, training, technical support, and financial capacity and infrastructure building. Additionally, to achieve a higher level of disaster preparedness, the government should establish direct linkages among all institutions which are actively involved and engaged in disaster risk reduction, especially local institutions. Since its inception about 66 years ago, Pakistan has experienced a variety of both natural and man-made disasters like earthquakes in 2005 and 2015 and widespread flooding in 2010. Pakistan has also experienced a range of politically motivated violence, bombings in urban areas, as well as mass shootings. Such events generate many casualties. To minimize the loss of life, well coordinated pre hospital and in hospital response to disasters is required. The aim of this study is to identify all the existing peer reviewed medical literature on pre hospital and in hospital disaster preparedness and management in Pakistan. The reviewed articles show a lack of data regarding disaster management in Pakistan. Almost all the articles unanimously state the scarcity of planned pre hospital and in hospital management related to both man made as well as natural disasters. Schools flood emergency preparedness in Khyber Pakhtunkhwa province, Pakistan. The study examined the emergency preparedness of activities of 20 schools in 4 districts of Khyber Pakhtunkhwa province that had already been severely affected by floods. Through face-to-face interviews and a structured questionnaire, the 4 pillars of emergency preparedness, which includes emergency planning, preparation measures, safe school facilities, and hazard education and training. The study revealed that the majority of the sample schools had experienced more than one natural hazard-induced disaster, predominantly flooding, yet despite this had not undertaken adequate emergency preparedness activities. There are particular gaps with regard to plans for students with disabilities, the continuity of school operations after a disaster, the presence of maps to identify evacuation routes, the availability of emergency equipment and resources, disaster preparedness guidelines, and psychological first aid and crisis counseling. Coming to the MCQs, disaster management is a process of effectively preparing for and responding to disasters. It is aimed at A. Resettling people in the closest unaffected urban area. B. Collection of valuable data for future management objectives. C. Protecting public health and safety. D. Strengthening sewage and drinking water treatment facilities to resist the impact of a future disaster. E. Restoring a community's services, facilities, and residences to pre-disaster level. E. The answer is C. Protecting public health and safety. During a natural disaster like an earthquake or a flood, effective hazard management largely relies on A. Government agencies, B. Emergency responses, C. Pre-disaster planning and preparedness. D. Large number of hospitals. And E. Rapid construction efforts. So the answer is
C.
yes, the answer is C. Pre-disaster planning and preparedness. The extent to which a community's structural, social, and geographic area is likely to be damaged or disrupted by the impact of a particular hazard is termed as A. Capacity, B. Vulnerability, C. Risk, D. Hazard assessment, and E. Restoration.
A.
B.
The answer is B. Vulnerability. Vulnerability analysis is assessing the threats from potential hazards to the population and to infrastructure. Vulnerability analysis comes in which part of the disaster management cycle? A. Mitigation, B. Preparedness, C. Response, D. Recovery, and E. Restoration.
B.
Yes, the
B.
answer is B. Yes, the answer is B. In the aftermath of a major earthquake, implementing mitigation measures involves A. Providing emergency relief supplies and temporary shelters. B. Coordinating search and rescue operations. C. Long-term efforts to reduce or eliminate future disaster risks. D. Restoring critical infrastructure and services. And E. Conducting damage assessments and distributing financial aids.
A.
C.
The answer is yes. The answer is C. Triage is the process of deciding which patients should be treated first based on how sick or seriously injured they are. Choose the correct statement regarding triage. A. Timely access to emergency care can improve patient outcomes, but it is not directly related to the triage process. Patients are triaged based on the complexity of their illness, but this is not the primary factor considered in triage. The primary approach survey is to identify life-threatening conditions at triage, prioritize patients accordingly, and re-triage if their clinical status changes. D. Retriage is only necessary if a patient's condition significantly deteriorates, not if it improves. Triage is solely based on the order in which patients arrive at the emergency department.
C.
C.
Yes, the answer is C. On the one triage method is START. What does START stand for? A. Simple triage and rapid treatment. START tasking and rapid tracking. Simple tasking and rapid termination. Start talking about reassessing treatment and simple tasking and rapid treatment.
B.
The answer is A. Simple triage and rapid treatment. In preparation for potential natural disasters like hurricanes or earthquakes, developing and practicing an emergency plan occurs during which phase of disaster management? A. Response phase, B. Recovery phase, C. Mitigation phase, D. Preparedness phase, and E. Restoration phase.
C.
D.
The answer is D. Yes. A 38-year-old has cut his left arm in an industrial injury. He was brought to the emergency department by a workmate. He has a deep laceration of about 10 centimeters into the inner aspect of his arm. The wound was bleeding quite a bit, but the blood loss was controlled with a firm bandage. He looks pale and is sweating. His heart rate is 130 beats per minute, and his respiratory rate is 10 breaths per minute. Based on this information, where should he be triaged? Number A, red. B, B yellow, C green, D black, and E blue.
A.
The
B.
answer is the answer is B yellow. After a devastating tornado has struck a town, the phase that focuses on restoring the physical, social, physical, economic, and organizational infrastructure of the community is A. Response phase, B. Recovery phase, C. Mitigation phase, D. Preparedness phase, and E. Restoration phase. The answer is B.
B.
Yes, the answer is B. This is the key of the MCQs. This is the link to our YouTube channel. Please like and subscribe, and thank you very much.
E.
Thank you very much, Dr. Amsha. Very nice presentation, and especially you have elaborated the recent aspects of disasters and the MCQ part again. It is wonderful. So, thank you very much, everyone, for joining today. So, see you in the department. Allah Hafiz.
Thank you, ma'am. Allah Hafiz.